In April of 2025, 16-year-old Adam Rain took his own life after a series of comforting conversations with ChatGPT about his suicidal thoughts. Following his death, Adam's parents reviewed his conversations with OpenAI and discovered deeply troubling messages in which the chatbot appeared to encourage his suicidality and even outlined a plan for what it called a quote, beautiful suicide. My name is Sonoya Raposo, a third year undergraduate student at Duke University majoring in neuroscience and psychology. And today I'm discussing a critical issue at the intersection of adolescent mental health and rapidly advancing technology: adolescent suicidality in the age of artificial intelligence. Why are youth increasingly turning to AI rather than humans for emotional or mental health support? And how should clinicians, parents, and policymakers respond to this shift? The demand for mental health support among young people has intensified dramatically over the past decade. Virtual therapy usage increased 63-fold between 2019 and 2020, from fewer than 1 million users to over 50 million users in just 1 year. But despite this surge, the suicide rate among adolescents rose by 16% between 2011 and 2022. Today, suicide remains the second leading cause of death for youth ages 10 to 24. This crisis led pediatric and mental health organizations to declare a national state of emergency in children's mental health. To understand why AI cannot replace professional care, it helps to look at cognitive behavioral therapy, or CBT, the most widely used evidence based treatment for suicidal ideation. CBT is built on three key principles. Psychological problems often stem from unhelpful or distorted thinking. People fall into learned patterns of harmful or ineffective behavior. And lastly, with proper guidance, individuals can learn healthier coping strategies, reframe distorted thoughts, and change behavior. CBT can be delivered in person or online through platforms like telehealth or secure video calls. And as research progresses, newer models such as the stepped care model tailor treatment intensity to the severity of a patient's symptoms, making therapy more personalized, efficient, and effective for adolescents experiencing suicidal ideation. The crucial point is that CBT requires a trained clinician who can recognize distorted thinking and respond with empathy, expertise, and most importantly, accountability. There are many factors that contribute to adolescent suicidality, and due to the multitude of factors an adolescent can experience, it's important to navigate and continually improve the mental health resources available because factors to suicidality constantly change, whether that's person to person or throughout our lifespan. However, the biggest problem for adolescents specifically are the difficult boundaries that they face when seeking help. In a study by John Goodwin and colleagues from the Journal of Adolescent Research, adolescent perceptions on mental health services named confidentiality, lack of awareness and familiarity, and the cost of access to be the most influential barriers to mental health resources. The design of this study used an interpretive descriptive methodology, which was underpinned by the assumption of multiple realities and the idea that knowledge is highly subjective, and the researchers' interpretations play an integral part in the research process. They interpreted their data through drawings that the participant made after they were given a prompt, such as draw a person who works in mental health services. This led them to work towards their research question while not being confined to the traditional methodology, allowing them to find deeper meanings within their data. Picture this: you are a teenager who is experiencing mental health problems, but you don't know where to start and how to reach out to get help. You know that therapy is expensive, you know that your parents may be notified, and you also know that you feel that there is some stigma around multiple mental health disorders. And lastly, you have school, you have sports, you have responsibilities, which leaves little room for appointments. Because of these obstacles, teens often seek support from tools that are free, easy to access, always available, and seemingly anonymous. For many, that tool is ChatGPT. From a teenager's perspective, ChatGPT feels safe. It listens without judgment, responds immediately, and seems knowledgeable. but these perceived strengths can become dangerous when the tool is used as a substitute for human care. AI's role in mental health care is a complicated and ongoing conversation. Many of the data on this topic is also reliant on professionals in computer science and professionals in psychotherapy opinions on the topic. Research done by a professional in computer science, Nazi Shimran, and colleagues published in the Pakistan Journal of Medical Sciences reported that AI can help aid mental health professionals in a multitude of ways, with the most influential being that AI can help clinicians identify patterns associated with anxiety, depression, and even suicidal ideation using sophisticated deep learning models. Therapists and researchers increasingly use AI to support screening, documentation, and early detection. Nonetheless, most of the professionals in the field of psychotherapy and computer science agree that AI cannot replace a therapist. ChatGPT is designed for conversation and user satisfaction, not for clinical judgment. It lacks the emotional understanding, ethical standards, and professional training required to safely navigate suicidal thinking. Nazi Shimran and colleagues also reported that AI is unable to detect warning signs and ask relevant questions to assess safety, which can lead to catastrophic outcomes. And from a neuropsychological perspective, a study done by David Olawad and colleagues reported the same results regarding the harms of AI when used inappropriately. The methodology of this study included an extensive literature review on different accessible AI driven therapeutic tools in which they explained the benefits and the harms of the uses of AI as a mental health resource, with a majority of the harms being similar to that of the Imran study. Moreover, AI cannot diagnose, it cannot create treatment plans, and it cannot reliably respond to crises. When adolescents turn to AI because professional help feels out of reach, they may receive responses that are unintentionally reinforcing their fears or hopelessness. This is just a small snippet of what ChatGPT told Adam Rain just days before Adam took his own life. Adam sent ChatGPT a picture of his neck after attempting to hang himself and asked, quote, "Will anyone notice this?" To which ChatGPT gave advice on how to hide the redness on his neck to not draw attention to the mental health issues going on within his brain and the actions that he was taking towards these issues. First, we must reinforce the understanding that AI should be an assistant, not a therapist. It can support research, help clinicians identify risks, and supplement care, but it cannot replace the therapeutic relationship. How do we protect our adolescents? We must expand access to evidence based treatments like CBT. This includes improving insurance coverage, reducing wait times for appointments, increasing the number of trained professionals, and funding programs that reach underserved communities. We must inform adolescents, their parents, and educators about the limitations of AI in emotional contexts. Schools and families should teach students how to seek safe, human led support and how to use online tools responsibly. And lastly, policymakers and healthcare providers must collaborate to regulate mental health related AI tools to prevent misuse and ensure that vulnerable young people are not put at risk. Before I end my talk, I wanted to share a quote that heavily resonated with me throughout my time researching this topic. AI is like fire. If we can control it, it can become a source of power. Otherwise, it can become a source of destruction. The tragedy of Adam Rain serves as a painful reminder of what can happen when technology oversteps its intended role in mental health care. Therefore, ensuring adolescents receive human led care when needed can prevent the harmful consequences of relying solely on AI tools in therapeutic contexts. Thank you.